The following interview with Christopher Altchek and Kareem Zaki of Cadence was recorded back in October 2021, so it is a bit dated before this release. Before the team actually announced their $100 million Series B financing at a $1 billion plus valuation. Nevertheless, while it's still dated by about 2 months, I thought some of these insights and the founding story of Cadence were still very interesting and relevant. So I hope you enjoy this conversation. Good afternoon. Welcome back to the Finding Genius video series. Kareem and Chris, thank you so much for taking the time.
Happy to be here.
Chris and Kareem are co-founders of Cadence, and Kareem is also a general partner with Thrive. He's also the co-founder of Cedar. Cadence is building a remote care management platform that delivers care to people managing chronic conditions at scale. Cadence recently announced a $41 million funding round led by General Catalyst and Thrive, and with participation from investors including Chelsea Clinton's fund. Chris, Kareem, before we kick in, I think just to level set and learn a bit more about your backgrounds, but Chris, maybe we can start with you. But the period between building Mike, which was a fairly successful media company, and the 3 years that led to founding Cadence, can you discuss your decision to transition into healthcare and kind of what that entire process of starting the company looked like?
Sure. So very, very quickly, I started Mike in 2011. We sold it in 2018. It was a mission-driven company. I learned a ton through that experience. As any first-time entrepreneur goes through building and scaling a company to a couple hundred people, you make a bunch of mistakes, and hopefully you're lucky enough to have the opportunity to build something again the second time. And so after we sold Mike, in 2018, I knew I wanted to build in health tech next. My wife is an ICU doctor, and I come from a family of physicians. And as part of making that transition, I knew I had a lot to learn. And so I was lucky enough to partner up with Kareem and his team at Thrive as an EIR, and spent a couple years just learning as much as possible about healthcare and health technology. Spent a bunch of time with a bunch of the big systems in New York City and learning about what was happening on the hospital side. And really spent a bunch of time with the incubations team at Thrive, getting smart as fast as possible. And so those 2 years, sort of in the wilderness, were hugely valuable. But I knew I wanted to build something in health tech, and so surrounded myself with the people who could help me get smart fast. And the big sort of focus for me was to do something again that was mission driven, that could concretely help people on a daily basis, and then that I could spend 15 years building and would be just as interesting in year 10 as it was in year 1. And so we started working on Cadence, and that was really an idea that checked all the boxes for me and felt like one that we could spend the next 15 years fully dedicated to.
Kareem, Chris just mentioned it a bit, but could you talk a bit about the incubation model that you all have started at Thrive? I mean, you've been part of some really incredible healthcare companies. Cedar is probably the more recent one that folks know about, but then in different verticals of healthcare. Can you talk a bit about how that functions, how that works, how you think about the focus areas that you're going after, and then the process of identifying Chris as the CEO and kind of the co-founder of building this specific business within this space? I think that would be helpful for other funds to learn from, and then also other founders too.
Definitely. I think it comes kind of organically just from Thrive being an entrepreneurial place. I'd be lying if I said we had kind of a perfect setup and a perfect formula on kind of how we pursue these things, but it comes from an entrepreneurial place. Thrive tends to be trying to proactive about opportunities and themes, and also being proactive about working with world-class founders. We've known Chris for over 2 decades and super excited to be building something together. And similarly, we've known Florian from Cedar for a long time before then, and Mario from Oscar for a long time before then. And then the second thing is, we end up spending a lot of time on these companies we're co-founders of, and so really spend our energy really focusing on what are really big opportunities, big needle-moving opportunities. And a lot of them have actually ended up in healthcare, because the approach that we've taken at Thrive, both on our investment side, but also on the company building side, is that to really move the needle in healthcare, you can't just sell a tool, you have to sell a solution. And you have to take on a big part of the piece and not just be a small puzzle piece in the broad thing. And part of that is because healthcare is really big and it's really complex. But part of that too is technologically, it's not really set up in a way just to plug in. a lot of times once you start building something, you start unpacking and realizing that there's a lot of things that you have to start building from scratch. And so fundamentally, your surface area of product starts to grow and grow. Also, you realize that a lot of the challenges that exist are because data is siloed. And when you start to bring that all under one roof, a lot of magic gets unlocked. A lot of things focus on Cadence is bringing a lot of that data together in a place that actually can drive action, where if you go look at a lot of these health systems or even payers, these data sit in lots of different areas. And the last part too is to take kind of some of these big swings. You need a lot of capital to kind of go do it. And so, as both capital partners, co-founders, kind of bringing that conviction to the table, we found that model works really well. And so we're just really focused on working on, world-class entrepreneurs like Chris, going after big ideas, where we have a lot of personal conviction around as well. That's
interesting.
The last thing I mentioned, but also a super important part of it because of all the time we have spending on it.
Right. And I think I do want to spend quite a bit of time talking about Cadence, but before we get into that, you mentioned world-class founders, and I think it would be interesting to just focus a bit on that because, Chris, you're a serial entrepreneur. I think your evolution as a founder would be great to just learn from in terms of some of the qualities that you've doubled down on when you're starting this company, or new ones and new skills you've had to develop thinking about it. But then also Kareem, but you mentioned Florian, you mentioned Chris, and you're picking these world-class entrepreneurs to start these companies. I think commonplace is for VCs to talk about we invest in founders, and then it's pretty vague after that. So I think it would be helpful just to hear some of the qualities that you're looking at in genius founders, and then specifically when you are building healthcare companies too. It would be great to just hear some of that background on those world-class founders from both your perspectives.
Kareem, I'll let you go first.
Okay.
Feel free to compliment Chris, is what he's saying.
Yeah, of course. No, I think, a couple things really come to mind. And first and foremost, we realize that companies are really about the people and the culture that you bring around the table to kind of go execute on this, especially when you're not building a company for 5 years, but you're building a company for multiple decades. And so that quickly becomes the most important thing that needs to be built. And so founders that have a deep empathy, appreciation for bringing and creating talent magnets and hubs where people's full potential can kind of be realized, where they can kind of pursue this and drive and go forward. I think also two founders who are deeply mission driven as well, because when you're motivated by a mission more than a specific product you want to see, or obviously a specific financial outcome, that drives kind of the ambition, the focus of the company, and tends to be much more long-term in nature. And again, going after big opportunities, we want founders who are mission-oriented in the opportunities that they go after. And as you kind of heard Chris in the beginning, I think a big drive of Cadence is the mission, the ability to serve, not just hundreds or thousands of patients is kind of how we've done today in a remote setting, but to do millions and tens of millions of patients, just given the crisis that we're facing at hand, but also the technological opportunity to bring these to people and change their lives almost immediately, as we're even seeing today with Cadence. And then the last thing is founders who can kind of zoom in and zoom out really well, which is being able to dive into the details, assess, be able to drive the decision and prioritization, but at the same time be able to step back, see where the market's going, where are the opportunities, and how do we position the company, not just for the next quarter, but how you position the company over the next couple of years. And so you have some people who are really visionary, and they can kind of tell you where the world's going to go, but then you ask them to connect the dots, and it's a little hazier. And you have some people who are, execution tactical machines. You give them a plan, they're going to get it done, 2 weeks early, but they struggle to kind of zoom out and kind of see where the world's going and make sure that they're putting the energy in the right place. And so we've been fortunate to back a lot of founders who have those traits and partner with them.
Got it. Yeah, and I would add the being the sort of the lessons I learned the first go around building Mike were, first and foremost, it's all about the people. I mean, you hear that and you hear people repeat it, but it takes a lot to actually really believe it and operationalize it. And so, from day one at Cadence, we've been focused on building a world-class team and world-class culture. And if you just look at our leadership team today, the company's been around for 10 months, but we have, multiple leaders who've run super successful multi-billion-dollar businesses with, orgs of 200, 300, 400 people reporting into them in their previous jobs, but also who have the capability to go 0 to 1 and build something. And so I think attracting, retaining, and then motivating and inspiring a world-class group of people is sort of first and foremost the thing that that I learned through my first experience. And then the second thing is just continuing to be humble and know that you don't know all the answers, but there's a lot of smart people around the table who can help you get to the right answers, and having that sort of growth mindset is really critical. I mean, for me, especially transitioning into a new industry and needing to, get on the learning curve get smart on the learning curve very, very fast. That's been something I've been, super focused on, and I think actually has helped develop the right type of culture where, the people who we've brought on, have a ton of responsibility and are teaching the rest of the company as much as they're, getting direction from me. And so that's been a big driver of what I think success is going to look like in this, in this phase.
Got it. Interesting. And you just mentioned the learning curve and the knowledge gap with this space. And I think, and then COVID threw a wrench in probably all those plans. But can you discuss, and I don't know how much you're willing to disclose at this point, but when the founding thesis of Cadence began, was laid out as a business model, product strategy, the problem that you were going after, can you talk about some of those plans of those millions of people that you're looking to help and support? And then how COVID-19 forced some of those plans to evolve, and how as CEOs and co-founders you evolved with it. I think it would just be interesting to hear some of the experiences as healthcare founders during the pandemic and how that has shaped the business strategy too.
Yeah, so I mean, I guess very high level, our chief medical officer, who's a cardiologist in South Florida, was one of the people who really brought this idea to our forefront as something that, was sort of an underbuilt, underutilized space that was obviously coming. And, in the cardiology space, it's a little bit more accelerated than other places. But it was very clear from our initial conversations that this was that remote monitoring for patients with chronic conditions and virtual care was obviously where the world was going to go in the next 5 years, despite it being around for the last 10 or 10 plus. But that COVID was accelerating that because it's better for patients, it's better for clinicians, and it's better for the healthcare system. And so incentives are actually pretty broadly aligned around this, and that it hadn't been done at significant scale with significant quality, and back to Kareem's initial point of solving the whole problem as a holistic solution, as opposed to just providing a small piece of technology and letting people figure it out. And so, COVID really accelerated all of digital health, but accelerated telehealth and remote monitoring and the ability to care for people outside the four walls of the hospital as a sort of a major theme. And so that's, we should talk about that. And then secondly, we should talk about building a company during COVID. And, before we go to that, Kareem, I don't know if you want to talk a little bit how we were, what you've seen across health tech and why the last 18 months has driven some of these themes to the forefront.
And I think it would be interesting too to also hear from Kareem's perspective on why this hadn't happened. I mean, this has been going on for 10 to 15 years, like Chris just said, but if it was the quality or was the adoption or the compliance in terms of remote patient monitoring, was it a payer problem? Was it a regulatory problem? I think it would be interesting to hear about timing also.
Definitely. I think the impact from COVID, and I think that kind of dovetails nicely into your question, is that we saw across lots of industries, but especially in healthcare, just pulled the future forward. And you saw telehealth and telemedicine increase by 50 to 100x penetration, from a couple single percentage to, I think at some point, the majority of visits were happening, in some fields, all through telemedicine. And then you actually had a bigger switch even beyond the consumer, so they actually brought the providers on board with the value of telehealth. I think a lot of times they went from being resistance points to actually, in a lot of cases, becoming evangelists and really supporting and seeing the value and the efficiency that they can drive through telemedicine, realizing they can actually deliver a lot more care remotely than they even thought possible. And kind of COVID forced us into that situation. I think to your point on why haven't we seen this more, I think one was the receptivity, of providers to really be engaged in this. At least from our view, if we're going to make this a big impact, and not just kind of what I think we call telemedicine 1.0, which is, for lack of a better word, a FaceTime or a Zoom call with a doctor that you never speak to again. could be okay for a case of, some of this urgent care, but broadly, all the, chronic diseases, any complex form of care takes multiple times of visits, continuity of care, and a lot of times a coordination between the offline and digital world to make it happen. And so as we've kind of seen a lot of providers really step into this digital world and really accelerate, bring the future 5-10 years forward, we actually think we're in the position now to give a unique care continuum platform that engages and works with these health systems, allows them to step forward in the digital world, and is a holistic solution for patients and not just a one-off telemedicine call or for 30 days we'll help you in this one situation. But actually we're in a position now to have a long-term relationship connecting the dots between the physician you see in life, the treatment you're getting, and also your kind of continuation of care at home, which I think fundamentally we're very excited about because we believe in the personalization of medicine driven by data. We can collect way more data points than we ever could before. But also the fact that even the most engaged patients maybe see their doctor once every 2 weeks, once a month, and we're engaging with patients on a daily basis multiple times a day, and that's just leading to dramatically better patient outcomes as well.
Got it. And I think this goes to my next point, everything you just said about there have been other attempts, and I'll name some companies, but not to knock what they're working on, but their own individual approaches to remote patient monitoring, whether it's Parsley Health, it's the Teledocs, the Galileos of the world. And can you discuss how, to the extent that you're comfortable, what Cadence's value proposition is, or is it going where Galileo might be going direct to consumer and they're going and working with hospices? Can you talk about Cadence's value proposition and perhaps the partnerships with health systems, because you've launched with some larger partnerships when you launched out of Stealth, or maybe it's around, like you were saying, the data and the wellness information that you're collecting, or the delivery of care, or the care coordination. Can you talk a bit more about what Cadence's value proposition is when you look at the full stack of other remote patient monitoring startups that are out there?
Yeah, I think the sort of zooming out, what's important to note is, we're focused right now on chronic conditions. And if you sort of zoom out on what's happening with the management of chronic conditions in the U.S., we're doing a terrible job, whether it's heart failure, COPD, hypertension, type 2 diabetes. These are conditions that impact half of all adults over 65 in the U.S., and a very small percentage of those patients right now are following best practices, world-class care that you would get at a really good health system. And the reason that this big gap exists is because it's too time consuming, and the incentives haven't been set up, and the technology hasn't been set up at any sense of scale to really support these patients and support the clinicians who are treating the patients. So the scope and magnitude of the gap is gigantic. I think that's the sort of first place to start. So we're not very focused on competition at Cadence, because the market is, it's wide open. And we don't even think about it, the market. The number of patients who are not receiving world-class care is in the tens of millions. So that's sort of where we start. And then when you zoom in, I guess I'll tell a patient story from last week. We had a patient, last week who woke up, took her blood pressure with our device that sends us the data automatically. The patient has heart failure. Her blood pressure was incredibly high. So we automatically asked her to take it again to make sure the reading was right. Got the reading again. It was even higher than the first one. One of our APPs, a very highly trained nurse practitioner who's working remotely, who's spent the last 20 years at a top center treating heart failure patient, gets on the phone with the patient within 15 minutes. The patient is at risk of severe tissue damage, something like a stroke, because they have uncontrolled hypertension that's accelerating. And so we end up sending that patient to the ER to get that under control and make sure that we get her blood pressure down before she could potentially have a stroke. That kind of thing is happening very frequently with our product. We've been deployed, on not a huge patient population today, and it's just very clear that this type of and solution is the right word, technology plus care team plus workflows plus escalation pathway is having and going to to have a very, very meaningful impact on a lot of patients' lives. And so that's how we think about it.
Got it.
And, from an initial partnership standpoint, we were fortunate enough to work with one of the largest health systems in the U.S. that's primarily in rural population, that has a team of leaders that's super innovative, and they're responsible for patients across 35 states in rural America, and they were the ones who said, this is going to become the standard of care. Our goal is to deliver the highest quality care across all these communities across the U.S. We want to work with Cadence to help make that a reality. And so for us, it's about finding people who have the vision to really see where the world is going and who want to make sure that all their patients are getting the best possible care. And luckily we're finding a lot of people who share that mindset.
Got it. And when you're thinking about building product for this, can you talk a bit more about that side of it? Is it optimizing more for patient compliance so that they are actually, like you just said in that example, actually monitoring their vitals? Is it, or what else are you thinking about when you are launching and thinking about your product roadmap and connecting those details that Kareem was mentioning in the beginning with the broader vision of what you're working towards?
Yeah, I think it's balancing the patient and the clinical perspective and taking both really seriously. There are a lot of health tech entrepreneurs who sort of aren't maybe connecting with clinicians closely enough to really understand what they need and what they want, and then connecting with patients and really deeply understanding those pieces. So we spent a lot of time understanding the user journey for both patients and clinicians, and making sure we're making both of their lives as easy as possible. And so our product reflects that. So it's very, very easy for patients over 65 who may not be the most tech literate in the U.S. to engage meaningfully on a very regular basis with no friction. And then from a clinician standpoint, we understand that if you're running a cardiology office or a PCP office, you are really busy, you have a lot going on, you're seeing a lot of patients every day, and the last thing you want is somebody dumping 1,000 patients worth of data on you and making you responsible for now handling it. And so we need to make it so that our solution does not add any additional work and really fits in with what they're trying to accomplish and makes their lives easier, not more complicated. That sounds really simple, but actually to execute all that is a very meaningful product challenge.
Right. And I think, sorry.
No, I was just going to say, while the umbrella of digital and remote care is a broad one, and we could list a lot of companies in it, I think defining the problem space that you want to solve influences the product to the point that Chris talked about. And for us, we want to focus on the major chronic diseases for the middle of the population. Because for a long time, actually, we've created a lot of these digital health solutions, but it's sold to high-end employers who are actually able to spend more on healthcare than they did before. There are these extra things that they're paying on top of and being able to drive that forward. And we're really focused on working with health systems that see the majority of patients, working within their existing business models and their systems, and wanting to integrate that care because we want to focus on chronic diseases, to the earlier point, where it's going to take multiple touch points. There's going to be in person, there's going to be a specialist, there's going to be checking at home. And how do you not make that a siloed experience, but actually connect it? And so to that point, we need to make it dead simple that we can engage with patients on a daily basis without being a burden. It needs to be integrated back into the health system so that it's not this isolated experience. When they go see their physician in person, it's all seamless and integrated in there. And we need to build it with longevity in mind.
Got it.
And using the data and the insights to kind of drive that.
And Kareem, you've founded companies before in the past, and you've continued to invest in them. When you are talking about some of those insights and the user journeys, and Chris was mentioning that you don't want to create a solution that's more complicated. Can you talk about a bit, maybe that proprietary secret sauce of the Thrive incubation model, or Chris, what you've done at Mike, of how you analyze the user journey and how you pull insights out of what's going to inform product, or any strategies or thoughts you have on that have worked well for a lot of the companies that you've worked with?
Definitely. I think, unfortunately, just given where the consumer and the patient experience is in healthcare, it's very easy to make it better I think the challenge is how do you integrate it into an already really complex system? It's complex because of how payers operate. It's complex because of how providers operate. It's complex because patients have a trouble understanding a lot of the things that are going on in their own diseases. And so the reality is, how do you take a lot of these magical and engaging consumer experiences that we've seen in lots of different industries and integrate it into these complex systems that exist today? And so that's where we spend a lot of energy as Thrive, building these companies, really focusing on the end journey, knowing that it's a low bar, unfortunately, to kind of clear what exists today. But actually, more importantly, how does this not feel so siloed and totally disconnected from the healthcare system? Because in that world, we just worry we're not going to be able to impact tens of millions of patients. You might be able to find certain niches that you can operate and sell into, but how do you plug it into the main pipes and systems that healthcare operates on? And one, obviously, we think that leads to bigger businesses because you're touching more patients. But I think more importantly, time is of the essence to solve the healthcare problem in the U.S. Costs continue to escalate out of control. Outcomes continue to decline. And we feel it's imperative, and in all the companies we're a part of, scale is a huge part of the mission because we want to reach so many patients to drive this forward, because we think that the health of our country, the physical stability of our country really depends on it.
Got it. Interesting. And I know we're running up on time, so just maybe 2 or 3 more questions if we can fit them in. But Kareem, when you're looking at the future of venture and your decision as a GP at Thrive to also now incubate businesses, but then also act as a co-founder, is this a very conscious decision that you believe that this is the way venture is headed and this is how Thrive is going to continue to evolve its model? I know other GPs at Thrive are doing the same within different sectors. Could you talk a bit about your decision on which companies you're deciding to co-found, where you're just primarily only being a capital allocator, and the broader strategy around healthcare?
Definitely. I think within Thrive, I think it's just yes, we have lots of investors at Thrive who are also founding businesses. I think it's just part of the energy, the entrepreneurial spirit at Thrive, less of something that's mandated or pushed, but something that people kind of are gravitated towards and excited. I have less thoughts on whether it makes sense for other venture firms to kind of pursue that model. And then again, back to the previous point, I think a big part of it has to be deeply personal and exciting with high conviction. That's the main thing that we kind of drive, and we think that we can actually be uniquely good partners in driving these opportunities forward. And that's what pushes a lot of the excitement and commitment to kind of building these things. And very much because of that, a lot of times, these are things that our insights and ideas and opportunities have been building over years as we kind of collect and push our insights. And when we kind of have an idea and an instinct and opportunity that intersects with, an amazing founder and the ability to kind of get it out there in the right market timing, that's where these kind of things come together. And so it's more, I think, art and science and kind of how these things come together and when it happens and when that moment is. But the one thing is that the bar is very high for us to get involved in this way just because of the time it takes. And also we want to make sure that we're deeply personally convicted and excited about and personally motivated by the mission.
Got it. And Chris, perhaps just as a last question, but when you're looking at starting a healthcare company and some of the areas that Kareem just mentioned in terms of integrations as being one of the largest challenges, how were you covering that learning curve quick enough, or what advice would you have for other healthcare founders that are looking to do so? Is it in terms of thinking about how you measure outcomes for patients, like that example that you gave earlier with chronic heart failure, or is there other areas that you think are very important for healthcare founders to begin to understand fairly quickly before actually building the companies?
I mean, this may not sound revolutionary, but we've taken a very first principles approach to solving problems. And, for us, it's not only what's good for patients with chronic conditions, who are on the sicker side of things. And then 2, what do health systems need, and very large health systems need, to actually deliver this care at scale? And that's been the problem that we've solved, and been trying to solve it, and are solving it from a first principles basis. So I think we always go back to that and try to sort of really understand it from the ground up. I think the other pieces here, and some of the things that really benefited from Thrive's expertise, is on the regulatory side, on the integration side, on the the broader intricacies and nuances of health tech. You can run into major roadblocks and really slow down very meaningfully if you make mistakes, and the costs of mistakes are very high. And especially when you're partnering with the Fortune 20 of health systems, there's no room for error. And so, we've from day one overinvested in our infrastructure, in our security, in our compliance, in our licensing, to make sure that we are ready, able, and capable of scaling with our partners in a way that exceeds their expectations. And I think that is obviously capital intensive, but I think the right investment to make if you're trying to be the best partner for the biggest and best health systems in the U.S. And so that's where we overinvested, which, the big takeaway is you need capital and you need smart partners to be able to do that.
Great. Well, Chris, Kareem, thank you so much for the time. I know we went over a little bit, but I really appreciate it. This was very helpful.
Yeah,
thank you. It's fun.